There's a story that gets passed around about the only operation in history with a 300% mortality rate. A surgeon, working so fast his hands are a blur, takes a man's leg off in under 3 minutes. In his hurry, he cuts the fingers off his assistant. He slashes the coat of a spectator who drops dead on the spot from fright. The patient later dies of infection. So does the assistant. 3 dead from one operation. The surgeon's name was Robert Liston, and you'll find that story told as fact on hundreds of websites. I'm a vascular surgeon, and I'll tell you right now that the story is almost certainly nonsense. There isn't a single real source behind it. But the truth about Robert Liston is far stranger and far better than the myth, because he wasn't a butcher at all. He was one of the most skilled, and believe it or not, one of the safest surgeons of his age, standing at the exact moment surgery changed forever. This is a story of the fastest knife in the world, the day Payne walked out of the operating room, and the way we rewrite the past to make ourselves look clever. To make sense of Liston, you have to picture the world he worked in, and it's a world almost nobody alive can really feel in their gut. He was operating in London in the 1830s and 40s, and in those years, anesthesia did not exist. Not a weaker version of it, none at all. If you needed a leg off, you were carried into the theater wide awake. Strong men held you down. You got a strap of leather to bite on and maybe a mouthful of brandy, and then a surgeon cut through skin and muscle and bone while you screamed, because there was simply no other way it could be done. In a world like that, speed wasn't showmanship. Speed was mercy, and it was survival. Every extra second on the table meant more pain, more blood on the floor, and a better chance the patient died of shock before the surgeon ever finished. The quickest surgeon was the gentlest one, and the safest one at the same time. And nobody was quicker than Robert Liston. They called him the fastest knife in the West End, and men who watched him operate swore they could barely follow his hands. As a surgeon, I'd ask you to turn that cliche over, because the popular version of it is backwards. We picture the surgeon of that era as a brute who didn't care how much his patients suffered. It was the reverse. A man like Liston built his whole craft around cutting suffering down in the only way the laws of physics allowed him, by being faster than anyone else alive. His speed was the most advanced pain relief on the planet in 1840, and he was genuinely gifted with a blade, which the records make plain. Years earlier in Scotland, he had removed an enormous tumour from a woman's face, a growth nearly the size of her head, the sort of thing most surgeons wouldn't lay a knife to, and she survived it. He designed instruments good enough that a few of them still carry his name in operating theaters today. By the grim standards of his time, his patients tended to live. There's a detail people love to repeat about him, too, that he would clamp the knife between his teeth to keep both hands free, then snatch it back mid-operation. Whether that one is literally true or just part of the legend that grew around him, it catches something real about the man. Surgery as a piece of controlled violence, rehearsed until not a second was wasted. Then came the day that made him immortal for something other than his speed. In the autumn of 1846, over in Boston, a dentist named William Morton had shown that a patient could breathe in the vapor of ether and feel nothing while a surgeon worked. Word of it crossed the Atlantic and reached London through a physician named Francis Booth. On the 21st of December, 1846, at University College Hospital, Liston stepped up to perform an amputation. Except this time, the patient breathed ether first and went under. Liston took the leg off, and when the man came round and asked when they were going to begin, having felt none of it, the room understood that something enormous had just happened. Liston looked up at the students packed around him and said, "This Yankee dodge, gentlemen, beats mesmerism hollow." It was the first public operation under ether in Europe. Sit for a second with where that puts him in the history of medicine. He was the great master of the old world, the one where the only weapon against agony was a fast pair of hands. And he performed one of the first operations of the new world, the one where the patient simply sleeps. He stood right on the seam between the two. He died less than a year later, so he barely got to see the door he had helped open. But the whole way I operate came through it. Once a patient could be put to sleep, speed stopped being the thing that mattered. A surgeon no longer had to race the clock. He could slow down, look properly, work in careful layers instead of hacking against a screaming man's endurance. Anesthesia didn't only take away the pain, it handed surgery the one thing it had never had, which was time. 20 years on, a surgeon named Joseph Lister worked out that invisible germs were what turned wounds septic and taught the profession to work clean. One discovery gave us the freedom to go slowly, the other gave us the reason to go cleanly, and between them, the stopwatch that had ruled Liston's whole career simply stopped counting for anything. Nobody today rates a surgeon by how many seconds an amputation takes. We measure safety in sterile fields and teamwork and checklists, the slow, unglamorous things that were impossible in a room full of noise and blood. So the real Robert Liston is a hero of that turning point, not a punchline. Which brings me back to the lie, because the lie is worth taking seriously. That 300% mortality operation. Historians have gone looking for where it came from, and the trail goes cold. No eyewitness ever wrote it down. No hospital ledger records it. No newspaper of the day reported 3 people dying in one theater. As far as anyone can tell, the whole thing first surfaces in a lighthearted popular book published in 1983, well over a century after Liston was in his grave, and from there it spread across the internet as fact, repeated by people who never once stopped to ask where it began. It survives because it's a good story, and because it lets us feel a little superior to the barbaric doctors of the past. That's the part I'd like you to carry out of here, because it's much bigger than one surgeon. We do this all the time. We take people from the past who were working with everything they had, boxed in by limits we can barely imagine, and we turn them into fools and monsters so we can feel advanced by comparison. Usually the truth runs the other way. Liston wasn't a butcher. He was a master doing merciful work in a savage world, who then helped bring an end to that world's savagery, and the myth gets him almost exactly wrong. In an age where a satisfying falsehood can travel around the planet before the truth has its boots on, a man slandered by a good anecdote has something to teach all of us. Check where the story came from, especially when you badly want it to be true. If you'd like to see the other side of that coin, a case where the best and most respected doctors of the day really did harm a patient with the standard treatment of their time, and a president paid for it with his life, that story is already here on the channel. Watch it next.